Hi everyone. Today I'd like to talk to you on this podcast about what we call obsessive compulsive disorder, which is often known by many of you as OCD. OCD often involves a person's obsessive, distressing, intrusive thoughts and their related compulsions in life. What do I mean by that? Well, what I mean is that people who struggle with what we call OCD have behaviour which is often obsessive, that has to be repeated, creates a lot of distress for them, and their thoughts often plague them and make them feel pretty bad. So it can be very upsetting. But it not only upsets the person who's struggling with this condition, but also those people around you, for example, your friends and family, if you struggle with this problem. It's a bit like a bully digging away at your confidence, which isn't a very nice thing to have in your life at all. So doing compulsions, in other words, these rituals, are actually making the problem worse for you, because these rituals strengthen the meaning. For example, if I don't do my rituals today, something bad may happen to me or my family. This is what your intrusive negative thoughts are telling you. And therefore, they do not give you opportunities to discover that these feared consequences do not come true. In other words, you think that these things will become true by doing these things, but the reality is, by not doing these things, you will discover what the truth is about this whole situation. So this means really that a person is more likely to keep doing these rituals and any other unhelpful behaviour, believing that that's the only way they're going to be able to feel in control of their life and to be able to cope with everyday life as it is. For example, you may have tried to push the thought out that comes into your head telling you to do this ritual, but it doesn't work, and the thought comes back even stronger a few hours or a few days later. Because people think that by doing compulsions, rituals, as a way of getting rid of the thought, and therefore make themselves feel better, but they end up feeling worse, when actually the problem gets worse and worse every time you fall into this trap instead of getting better. And some of you who are struggling with this OCD problem may also have general anxiety in your life and have a lot of depression, which doesn't help. That makes things worse. So what causes this OCD, this obsessive compulsive disorder? Well, we're told by the experts that it can be genetics, meaning that you might have family members who've struggled with this throughout their life, so they've passed it on to you through the genetics of the family. It may be that we're told that certain changes in some people's brains when they're born can create this condition. But I think there's still some research going on around this issue. And also childhood trauma. When you were a very young person in your early childhood, you may have experienced some very difficult, painful, frightening circumstances, situations that have triggered this problem for you. So that's really some of the main causes of what we call OCD. And then I just want to mention the compulsions and the rituals a bit more. Some of those might be to do with washing and cleaning, the obsession about doing those things, the need to check everything on a daily basis. When you do something, having to check it again to make sure that you've completed what you set out to do, or you might feel the need to repeat things because you feel very insecure and not in control if you're not repeating things, which leads on to correcting your thoughts, having to repeat things because your thoughts are telling you that those things don't appear to be right. And then the whole issue of reassurance, which I want to go into in some depth, is one of the main problems of OCD. And also avoidance. You may feel that you want to the need to avoid certain things, people, situations, because they've caused you in the past a lot of pain, a lot of misery, and made you feel ashamed or embarrassed. So also people who struggle with OCD sometimes are what we call hoarders. They keep a lot of stuff in the house that they don't need. They build up a lot of material because they feel safe and they feel more in control with that stuff in the house or in their lives generally. But in fact, it produces a lot of clutter and confusion, and you're not able to have any space and order in your life to know what's going on. So it creates the opposite of giving you self-control. So reassurance seeking, as we've said, OCD can involve reassurance seeking as a way to comfort your uncertainty. When you live throughout your daily life, there will be times when you feel uncertainty and you feel that the reassurance seeking will help you feel more in control in those situations. For example, as I've said, asking a friend or a family if you've washed your hands enough because you can't believe what you've done is true. And I'd like to now talk about three types of reassurance that people often struggle with. One is self-reassurance, as I've said, like checking a door is locked after you've gone and closed it because you're worried about what might happen if you haven't closed it properly, or repeating a thought, thinking that it was a bad thought and trying to make sure that it's a good thought because you're worried whether it's going to come true or not. And then this whole thing around seeking reassurance from others. A person with OCD may have to ask family and friends if something they've done is going to cause them to be a bad person or whether it's a good thing that they've done. It might be that when you're in a car, you feel that you've felt that you've run over somebody with the car, and asking the person with you whether that's happened, and they've told you that it's definitely not true, but you've got this idea that it might have happened because someone was close to the car as you were driving. And then also managing the urge to seek reassurance. That's the third thing I want to say about reassurance, because it's the hardest of the OCD problems to deal with. And some of the urges to reassurance often go unnoticed until after they've actually been committed by you. So you need to acknowledge the reassurance as soon as you've noticed it and to try to stop doing it as soon as you can. And that might be more difficult than we've said, because you may need help from a counsellor or a cognitive behavioural therapist to do this. But things like mindfulness can help you with this. The whole act of practicing accepting thoughts and feelings without evaluating them or acting on them. Because someone can learn to have an uncomfortable thought or feeling without over evaluating it or without responding to it, and mindfulness can help this situation with this if you do see a counsellor. So your goal is to remind yourself of what you already know. Is your goal to reduce your anxiety about something? And what is the best way to do that? If the answer to these two questions is yes, then it's best to resist asking for reassurance and instead practicing tolerating the discomfort until you get the professional help with that. And there's a lot of information online about OCD and mental health problems, and I would really warn you about looking online and getting mixed messages and getting more confused, because that's just going to go on to trigger a lot of your OCD problems. So we've said that OCD creates these obsessive thoughts of wondering what's true and what isn't true. These are intrusive thoughts. You would probably prefer not to do these time-consuming acts if you're struggling with OCD, but you feel perhaps driven because of your thoughts and your feelings to do this. And it's about, isn't it, not suffering what you believe to be the negative consequences, and to help you escape or reduce the anxiety by using these obsessions. But in fact you get yourself into a complete like a spider's web where you can't get out and you can't see a way through, and that's where you need the professional help to help you sort your thought life and to express your feelings. And the repetitive behaviours are all part of OCD, as we've said. But also I want to say something about the whole problem of fear with people who struggle with OCD. This fear of being perhaps contaminated by germs. They might feel that they're dirty themselves, and they're going to get germs if they touch something or someone, and yet it's all part of their negative intrusive thoughts. It's not necessarily true. And some young people and adults who struggle with this particular problem are obviously looking for self-control, so you get into a system of needing some order in your life. You go over the top with having to have things in a particular order at a particular time, and if anybody makes a decision or organises something, then you need to see it and know all about it, because it makes you feel very much out of control. And then the checking and rechecking, obviously to help reduce the anxiety caused by these rituals and obsessions, because it gives you a sense of reassurance and control. And we've already mentioned about an example like having doors closed after you, having to go and check them. And people suffering with OCD may avoid anything that may trigger their obsessive fears, because it might bring back feelings from the past of shame, loneliness and guilt about particular events. Now I want to just mention something about the impact on your self-esteem or confidence. People with OCD sometimes feel a lot of shame, and they struggle to believe in their own worth as a person, which is really sad. And they can't believe that any personal achievements that they've had in their life is really going to be able to help them be the person that they are and achieve something with their future. So it's really, really sad to be in that place and to struggle with that particular mindset. And also with the impact on your self-esteem, it may stop you doing things you want to do because you might have some regrets about what's happened in the past. And you might have a fear of yourself because of the anxiety that the OCD is creating for you. You might feel that you're a dangerous or immoral person when in fact you're not, but that's the thoughts you've got because of, as we've said, some childhood trauma or maybe some distressing situation or event that's happened to you that's made you start to believe these untrue messages and these untrue thoughts that you have. Also, OCD can affect your identity issues. It can affect your personal beliefs and values, as we've said. So some of the thoughts that you have about how you should live with OCD stop you from believing the truth about yourself. And as we've said, you might have worries about being a bad person, and obviously you're not. And also it gives you some uncertainty about obsessions about your body, how you look, how other people see you, what they think about you. And all these things aren't true, but these are the obsessions that you have about your body because of the negative intrusive thoughts from this condition of OCD. And then the future, fear that something bad will happen if everything isn't right as you feel it should be with your mind, and worrying about the uncertainty in your life. Perhaps this is because feelings of guilt or shame from events from the past, as we've said, but also the guilt and the shame knowing that you've got these struggles with OCD. And people around you trivializing your condition, trivializing your struggles with OCD, not taking them seriously and telling you that it's all in your mind, that you just need to get on and do other things and forget about it. So you might have picked up a lot of false ideas about what you're struggling with that may not be helpful, and they may stop you from seeking professional help. And then we need to go on and look at triggers to OCD. Well, obviously, it's very much linked to the anxiety and stress in your life. As we've said, a lot of negative, positive experiences can also, positive experiences can lead to some increased anxiety and obsessive thoughts and behaviours. Shame, guilt, maybe sadness of losing someone close to you. People with chronic stress, a lot of unnecessary stress in their life can be an ongoing trigger to your condition. Major life changes. Maybe you've been through a big breakup with a very long-term, close, loving relationship with someone. Maybe you've been made redundant. Maybe you've failed your qualifications with some top exams you've taken. And also, sometimes you might have forgotten to do an important task or neglected doing particular jobs at work, and they can trigger, again, a lot of anxiety and stress and create the ongoing problem with the OCD. And thoughts, images and memories are quite important because they can often trigger your condition, because they might make you feel embarrassed, ashamed, as we've said, and not feel, as we've said, you're worth anything as a person. And all these things are untrue, but the thoughts, the images and the memories have just continued to drive this problem in your life. So I'm sorry to be really negative about a lot of this condition, but there are strengths for people that are living with OCD, because you're the kind of person that maybe wants to give attention to detail. Whatever you do, you are concerned about the detail of it, that you've got everything right, and that can be a good thing in life. You're really good at focusing on something. You don't get pulled all over the place by something else that's going on. You have empathy. You've learnt that having empathy is important as a person, caring for other people, because you know what it's like to go through these problems and these struggles yourself with OCD, and that you like a routine, a structure to your week or your daily life, which is important because that's going to help you feel more self-control. And resilience, that is something that you're obviously concerned about, because it's going to help you live with this problem, be able to get the best help possible, to be able to contain it, control it, and manage the problem in your life. So I just want to now finish up with, how can counselling help you with your OCD issues? Well, it's important to think about going for counselling, because counselling can gradually expose you to feared situations that you've maybe avoided, while helping you resist performing the compulsions or the rituals that often end up replacing them. So confronting your fears is something that counsellors can help you with, and that's important if you're going to be able to manage this problem. And as we've said before, they can help you to identify the triggers and how to use positive alternatives to the negative, intrusive thoughts and actions. And you'll be challenged about your personal beliefs and values, but you'll be able to work through them in your mind with a professional to help you, and to help you to replace those personal beliefs and values that are not true, that are not positive, with realistic beliefs and the truth about yourself. But in order to do all this, you need to create a trusting relationship with someone like a counsellor, who's going to show you some empathy and self-care, and also accept you as you are, in a creative, safe space where you feel you can build trust with that person. Also to help you, as we've said, to set some realistic goals to help you manage this ongoing problem that you'll struggle with, and how to help you help yourself on a daily basis by perhaps doing alternative things to what you've done, to break the cycles that you are struggling with around the battle with these intrusive thoughts, to help you address some of the specific practical needs that you may find difficult, or also to help you work through and have better relationships with other people. And we've mentioned relaxation and mindfulness techniques, how to get better support from the family that you belong to help you to enable to explain to your family how they can support you in a more positive way that's going to make you feel a lot better. And also whether you need medication from the GP. If things get really bad with your OCD and it starts impacting on your daily life to such an extent, as well as seeing the therapist, the counsellor, maybe seeing your GP, and to look at treatment options, and also what support there is out there with others who are struggling with the same problems that you've got. And then finally, conclusion, how can you care for yourself if you have this problem? Well, it's important to get the right amount of quality sleep and to look at what helps you get that sleep. Maybe you're not getting enough exercise. Maybe you need to look at your healthy diet. Is it healthy enough? Maybe you need to change what you eat and what you don't eat. Spending more time with those who want to support you with this problem so they can encourage you. As we've said, doing the relaxation techniques, relaxing your muscles, breathing exercises, and then finally joining a support group with others that may be able to help you and you can help them. So I'm hoping that this podcast has been able to help you to understand a bit more about OCD and why people struggle with it, what it's about, and how you can manage yourself and get some further help through this. Thank you for listening. I hope to talk to you again later. Take care of yourself. Bye for now.